Welcome to Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health, where we bring evidence, experience, and perspective to make sense of today's leading health challenges. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
It's Lindsay Smith-Rogers. Thanks for joining us for Season 7 of the podcast. We'll be off for Memorial Day and returning Wednesday, May 31st for the first episode of Season 8. But first, a quick note about one of our other projects, Expert Insights. From the same team that has brought you the Public Health on Call podcast since March 2020, Expert Insights began as a daily newsletter rounding up everything we knew about COVID in that moment. Over the last 3 years, the newsletter evolved, and in 2023, the project won an Anthem Award for being a go-to public health resource. Framed by Bloomberg School researchers and rooted in science, Expert Insights informs readers about the most pressing public health topics. If you're not already, please consider subscribing to this twice-weekly resource. Visit publichealth.jhu.edu/subscribe or click the link in today's episode description and sign up today. Finally, some thank yous from this season of the podcast. Major thanks to Grace Fernandez for stepping in as producer while I was out on family leave, and to Annalise Winnie and Rachel Burvell for their work co-producing Public Health in the Field, the series on Black maternal health. Thank you also to our faithful team of interns, Kriti Baum, Hannah Bennett, and Caroline Wang. Finally, we'd also like to thank you, our listeners, for sharing your ideas and questions and for downloading this podcast nearly 10 million times. Keep writing us at publichealthquestion@jhu.edu, and thank you for being part of this podcast. Today, Stephanie Desmond talks to Dr. Raj Panjabi, an advisor on preparedness and response to President Biden, about the progress being made to ensure we are ready for future pandemics. Dr. Panjabi also shares some of what he will tell new Johns Hopkins Bloomberg School of Public Health graduates today as the Convocation speaker. Let's listen.
Raj Panjabi, thanks so much for joining me.
Thanks, Stephanie, for having me on.
So we're really excited that you're the Convocation speaker for the School of Public Health graduation. And I wanted to tell people a little bit about you before we talk. You're a physician, you're a professor, an epidemiologist, an entrepreneur, and a public servant, which is a mouthful right there. You led the President's Malaria Initiative, and you currently serve on the White House National Security Council as Senior Director for Global Health Security and Biodefense. So tell me what that means.
Sure. And my current role it focuses on working with the President and the National Security Advisor to execute federal policy to prevent, prepare for, and respond to pandemic and biological threats. Just a few examples of what we're working on, if that's useful, Stephanie, I'm happy to jump into. In the fall of 2022, the President released the National Biodefense Strategy, which is the nation's comprehensive plan to prevent, prepare for, and respond to the next pandemic and biological threat. And it has a number of lines of effort, including working to make sure we have breakthroughs such as vaccines within 100 days of a future pandemic, which is scientifically possible if we had the right resources to get it done. That's one example. There's other work within that biodefense strategy to invest in all 50 states' public health workforces and the systems that support those workers. And there's work in the biodefense strategy to work with other countries, including to strengthen health security, including the President's commitment to more than double the number of countries the United States works with around the world to over 50 countries by 2025. So that's just a sense of what we're working on through the National Security Council in coordination with our federal agencies, from Health and Human Services to the State Department to the Department of Defense and beyond.
So you are actively working to make sure that we respond better next time to a global pandemic or other emergency. Tell me sort of your assessment of how things went this time and how you're going to help make it better next time.
Well, I think some of the key things we've learned from the COVID response, and I was actually serving in COVID testing clinics in April 2020 in Massachusetts, where I was practicing as a physician, and then I was involved in some of the rollout in Massachusetts of the vaccination effort on mobile vans with nurses and in community centers and marginalized communities. So I speak a bit from that personal perspective, having been on as a physician, and a lot of our work is focused globally on COVID. The White House COVID team has largely managed and worked with our colleagues at the departments of HHS to work on the national response. So I'll speak a bit about from those vantage points. I think a couple lessons we've learned. There's work to be done. First of all, hundreds of millions of vaccines have gone into the arms of Americans here, and billions of shots have gone into arms around the world. It's been the largest vaccination campaign in a long time, and in some places ever. And I think what we've learned is that these efforts can save a lot of lives. I mean, we've seen a reduction in deaths from COVID from its peak by nearly 90% here in the US. Around the world, there has been a reduction in deaths and severe illnesses as well. The world just reached 70% in terms of vaccination coverage. So there's some things to feel really good about in terms of the work that was done, especially by frontline workers, local health departments here, countries around the world. And there's a recognition that we've got to be more efficient, more effective, and more equitable, especially on the global side, which has been a focus of mine in terms of getting vaccines to countries as well as other medical countermeasures. And so what are we doing about that? One is making sure that we have the capability in place to strengthen how countries develop surveillance systems and also strengthen their local public health workforces. The United States has put forward a couple of initiatives on that front. Number one has been the launch of the Pandemic Fund at the World Bank, which was a commitment that President Biden made on day one of the administration to launch such a mechanism. And over almost 20 countries joined us in providing seed financing to that pandemic fund. And what that does is to invest in labs, in local community health workers who can detect the next outbreak at its source, also to provide support for holistic surveillance. That's one example. The other is to ensure, in addition to our multilateral work, that we're also doubling down on the United States direct partnerships with countries. So the president and the White House made a commitment to, in the biodefense strategy, in fact, to more than double the number of countries we work with on health security to over 50 countries by 2025. So there's a lot more we need to do, Stephanie, in terms of preparedness. And it's worthwhile doing that because not only because it's the right thing to do, but because it is economically the smarter thing to do. For some analyses show that for every dollar we invest in pandemic preparedness, were the US to face a COVID-like pandemic in the future, for every dollar we invest, there's $1,100 in return in averted GDP loss and up to $1,700 in return in averted deaths in a situation like that. So this is actually both good for countries around the world that are facing epidemics like Ebola or Marburg, as we've seen in sub-Saharan Africa in the past year, and because it's useful for keeping Americans safe as well.
Do you feel like there's an increased will to do this because of the pandemic, or are people fatigued by the pandemic?
Look, I think we all experienced, many of us, significant losses in our families and in our communities. And a lot of us are asking the questions, what more can we do to honor the lives of people we've lost? And I think one important thing is to ensure that we act and we do everything in our power to prevent, prepare for, and respond to the next pandemic. And so to me, I find that there's a significant amount of momentum and energy to work on that. But we can't take that for granted either. I think the history of pandemics is ridden with a cycle of panic and neglect. So this won't just happen because there was a traumatic experience. And let's be clear, COVID's not over. We're continuing to work on it, both in the United States and around the world, with partners at the local level. And, we have to keep focused on strengthening our ability to respond the next time. So I think there's momentum. I'll give you a couple of examples where that exists. One is in the case of trying to get medical countermeasures developed more rapidly. And so the biodefense strategy, which was created by over 20 federal agencies working together, learning the lessons from COVID and other epidemic responses. In that biodefense strategy, there's a bold commitments to ensure the United States works towards a goal of having vaccines not in 300 days, but in 100 days, within 100 days of the next epidemic or pandemic, ensuring that those vaccines are available at the scale of the US population that might be at risk within 130 days, and then working with international partners to ensure the global at-risk population is vaccinated within 200 days. There are goals there to ensure that therapeutics are repurposed within 90 days of a future pandemic, and that novel therapies are developed within 180 days. There are goals to ensure that we stand up safe, high-quality clinical research trials within 14 days of the next pandemic so that we can ensure those goals are met. So, I mean, that's all of that will be possible with more financial resources, but the scientific and technical capability does exist to do that. And I think that's something we should all feel hopeful about. We need more resources, Congress to act and enact the discretionary requests that have been made, as well as the mandatory requests that have been made to the Hill to ensure that it is in place. I think another example on the domestic front is a commitment to local public health workers. The administration put forward the American Rescue Plan, within the American Rescue Plan, I should say, a $3.2 billion commitment that to strengthening the local public health workforce. That includes data scientists to contact tracers to community health workers. Over 107 jurisdictions in this country have received those resources. That's being managed by the CDC. And then globally, Stephanie, another example is the work that has been done to respond more rapidly to outbreaks. I lived through the West Africa Ebola outbreak in the country I grew up in, Liberia, a decade ago. That claimed 11,000 lives and 30,000 infections and had a loss of $53 billion to the local economies. In the fall of 2022, there was an Ebola outbreak in Uganda, which threatened to become one of the worst in history. And instead, what happened is a really strong local response by the Ugandans and also a commitment by the United States to flood with funding more rapidly, with staff to support the Ugandans. And in less than 100 days, that outbreak got to 0 cases. So I think there's not just hope, but there's a plan. And there's not just plan, but examples of how that plan, when executed to its most optimal level, can make it more possible for us to be more efficient. That is, faster when we respond, more effective, but also more equitable in the way we respond.
So we're better prepared now than we were when this all started. You're confident of that?
I think we're better prepared than where we were, and we still have a lot more work to do to get to where we need to be.
So you're going to be talking to public health graduates, and I'm curious sort of what big messages you have for them in this very disruptive time.
Well, I think the graduates, and I'm excited to be back at Hopkins. It's where I went to public health school for my degree in epidemiology about 18 years ago. And so it's been a generation, and I'm looking forward to meeting the graduates and, of course, reconnecting with faculty. They are facing a time in public health in this 21st century with unprecedented challenges. We must prepare for and prevent the next pandemic. We have to counter the impacts of climate change on health. We have to close inequities in life expectancy between Black, brown, and white, between rich and poor, between rural and urban. So on the one hand, public health has helped double life expectancy, right? Help double how long we live over the last century plus. And at the same time, we're facing the greatest reversal in life expectancy on the heels of the pandemic since World War II. So they're going to be faced with unprecedented challenges. And my messages are really threefold. One is a very personal one, that we are not defined by the conditions we face. We're defined by how we respond to them. And I'll reflect a bit on a lesson my father taught me there, that is no condition is permanent. Something my father said to me again and again as a child when we went through the Civil War in Liberia and came to this country as refugees and tried to rebuild our lives. And it helped get me through medical school and eventually to have the opportunity to work in the White House and serve the country to help build back my life. So that's really about how to deal with setbacks in one's careers. The second insight I want to share and offer comes from and is inspired by those on the front lines of public health. I was under the mentorship of Dr. George Comstock and Carl Taylor and Bob Lawrence when I was a student at Hopkins and at Bloomberg, and really benefited from the work and focus they had on community-based approaches to health. My first work in public health was with Alaska Community Health Aides in the Yukon Delta. And I think there's a lot we can learn from making public health more proximal to the people we wish to serve, investing in those people closest to the problem. And, the idea there is, for me at least, is meeting people where they are is perhaps the most significant public health lesson I've learned in my career, and is as relevant today as I work in the White House as it was when I was working as a physician on the front lines of public health. So lessons from community health workers that have worked the Ebola outbreak in West Africa, and as well as epidemics of malaria around the world. The third lesson that I want to share and offer really has to do with power. We cannot solve challenges in public health simply by focusing on technical solutions. Medical breakthroughs are not enough. Scientific knowledge is not enough. And so I will call on the graduates to not just work to be smart enough, but to be brave enough to take on the challenges of public health and to speak truth to power. And I'll give a couple of examples of where that's been done in public health to great success. So those are the three lessons. It's no condition is permanent, invest in the people closest to the problem, and to be brave enough, not just smart enough, to stand up and speak out for truth.
I could talk to you all day, but unfortunately I've reached the end of our time. Raj, Panjabi, thank you so much for your service and for your time today.
Stephanie, thank you so much.
Public Health on Call is a podcast from the Johns Hopkins Bloomberg School of Public Health, produced by Joshua Sharfstein, Lindsay Smith-Rogers, and Stephanie Desmond. Audio production by J.B. Arbogast, Holly Cardinale, Philip Porter, Spencer Greer, and Matthew Martin, with support from Chip Hickey. Distribution by Nick Moran. Production support from Catherine Ricardo. Social media run by Grace Fernandez and Shian Briscoe. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Thank you for listening.